All right, so we're going to be working with our kitty patient who is pretty reactive today. We're not very happy to be here, but the goal of this interaction is that we are going to be safely removing him from the kennel and administering an IM injection of sedation. And as just a side note, I want to make sure that I have my emergency drug sheet already ready to go, which I do. I know his code status, and we have signed consent, informed consent from his family that know that we're going to be sedating him today. And that keeps everybody as safe as possible. So I have my injection. Marley is my VA1 who's going to be helping us today. We're going to see how reactive he is to being removed from the kennel, and we might need to change our little game plan as we go, but the goal is to get him in a burrito, have something to contain the bitey end, and then we're going to give him his injection and let him sit for a few moments. Okay, so let's give it a go. Hi, buddy. Hello, my friend. I'm pretty stressed today. Hi. So I'm not coming in the cage, you know, guns blazing. I want to give him some time to appreciate that I'm here, but nothing bad is happening to him just yet. I'm kind of reading his body language and seeing he does seem to be a little bit curious, and so he's not completely fear-based at this time. And so we might be able to get him out with just a towel. Hi, bud. What do you think? Hi. Hello. And we are in a cat ward, so there's no dogs or anything like that. There's no other cats that are on the bottom to where, you know, they would, if he were to go by a cage, they're gonna get him. It's nice and quiet. We do have the door closed, and so he is contained. So even if he were to step away from me at this moment, it's safe and he's not going to be getting loose in the hospital. Hi, sweetheart. What do you think? I'm going to wait for him to take one more step out though, because I don't want him to just scoot all the way back into this cage when I go to put his towel on. Hi, what do you think? It's not too bad. Yeah, that's not too bad. Yeah. Okay, so we're a little bit more reactive. I'm gonna go ahead and put cat gloves on just to make sure that as I'm using this towel, he doesn't get through any of the little cracks, because I'm kind of reaching into the back of the cage, and I am a tall person and I am not this flexible, so we're gonna use our tools here to keep everybody safe. Hi, buddy, come here. Oh, no. There you working on the floor because then I'm able to have some better control over their body. So I'm just using my limbs to my advantage right now. And so the goal from this point is, and I'm going to remove the cat gloves so that I have a little bit better control, is I'm going to be asking Marley to help me put either the e-collar or the cat mask on. But I want to make sure that while she's doing that, she is also protected, because as I am restraining, I am in charge of her safety. And so I'm going to try and hold on to those front limbs while the back limbs are contained back here, to make sure that he doesn't reach up and scratch her. And we're going to see how this works, and if it doesn't go that well, then we might move to doing a clamshell and doing the injection through the clamshell. So let's see how it goes. I know, you're telling me so many things right now. Okay. All right, Marley, I have his front legs if you want to move forward. Which one would you prefer? Whatever you think is going to be safest for you to get on. Okay. I think he would prefer the cat mask. Hi, buddy. The cat mask can also sometimes be a little bit easier to get on if their heads are buried in the towel. go ahead, you can pull the towel on the back of his neck back a little bit more. I have him. There we go. No, we're gonna stay here. I know. Okay. And Marley's gonna give that a really good cinch and make sure that that's on. We're gonna check and make sure that his jaw isn't poking out the bottom, because they do like to drop their mouth at the last minute. There we go. It's okay, buddy. I know.
His chin is in.
Fantastic. And go ahead and cinch that down a little bit tighter there, Mar. Fantastic. Perfect. I know, buddy. That's all right. Okay, so now we have some control on that head so that nobody's gonna get bit, okay? And so now we're gonna move into doing a little bit of our kitty burrito. Something that a lot of people like to do is to put the towel on the table and then put the cat on top and then wrap it the way you would with a traditional burrito. I actually prefer to come from the top, and so that's just my little tidbit of personal experience. I feel that you're able to get the towel snugger against their body by starting at their shoulder blades. So whatever works best for you is totally great, but I do like to make sure that those front legs aren't popping out at the last minute. So we're gonna come forward just a little bit. I know, buddy, I'm so sorry. So I already have the towel over the top of him. I'm gonna take my hand here and I'm gonna swoop that front leg. So I have it contained right now. His other leg is on top of my hand. And I'm gonna take the other half of this towel and I'm gonna go just underneath his chin. And I'm gonna wrap that nice and tight in the front, okay? And then from that point, I don't even really have to hold a whole lot of pressure in the front because I have this little hand right here that's holding onto his front. That being said, because we did this from the position I'm in, his back legs are a little bit free right now. So I'm gonna ask Marley to step over. And she's just going to put a hand there and we're gonna work on our IM injection. Okay, so we have our friend, we kind of changed positions here. We have our friend in his cat mask with our burrito wrap. As you can see, because he's wrapped so well in the front, Marley doesn't have to do a whole lot of restraint in that front because the towel is doing it for her. We're gonna try to do some additional sedation IM right now because he is, again, a very reactive boy. So I'm gonna try and expose a little bit of this butt here. I'm gonna see if I can identify that spine. So I have my middle finger on the spine and I can feel his hip bone with my index finger. And so now I know that that little spot in the middle is gonna be his epaxial muscle, and that's where it's gonna be safe for me to inject. He's probably gonna be a little bit of a rodeo for this. And so that's something that you wanna be prepared for, okay? Okay, I'm gonna pull up a little bit to make sure I'm not getting air or blood, and then I'm going to inject and come straight out, okay? And I didn't go very far into that muscle. We just want to make sure that we're in there. We don't have to be spelunking down to the bottom of that muscle. We just want to make sure that it's solidly in so that it is truly an intramuscular injection and that we're not inadvertently giving a sub-Q injection. So for this one in particular, I probably only went about that far into the muscle. And that's why I do actually prefer smaller needles for smaller patients, is because the longer needles, when they're a larger gauge they become longer needles, sometimes you can go a little bit too far and you don't mean to. And it's just more painful. It's not more effective, it's just more painful. Sometimes you might have to do that though if you have a particularly chunky patient that has a very high body condition score. You might need to do a longer needle to make sure you're getting into the muscle and not just doing an intra-fat injection.